Thanks for so nice introduction. It's my glory to come here and on the World Conference of Infectious Diseases. My presentation entitled by Clinical Characteristics Analysis of Bordetella Pertussis infection in adult cough patients. There's no any interesting complete need to declaration. My presentation includes these three passions. First, let's review what is pertussis and its clinical and basic features. Pertussis has another well-known name, whooping cough. When coughing in episode attacked, it can violent enough to trigger vomiting. Patients' lips may turn blue when struggle to inhale enough oxygen, and the coughing is often worse at night and can continue for more than 3 months. In China, it is also known as the 100-day cough because of the long cough time. Pertussis is caused by bacterial Bordetella pertussis. It is a highly contagious bacterial disease of the respiratory tract. R zero pertussis is as high as 5.5, almost equal to the COVID-19. Pertussis spread easily from person to person, mainly through the droplet produced by coughing or sneezing. Pertussis occur mainly in infant and young children, and it's a significant cause of disease and death in these young kids. Pertussis can be prevented by immunization. The microbe caused to pertussis is isolated by 1906 by Belgian immunologist Jules Baudet and Octave Jenner, another Belgian microbiologist, and got the name of Bordetella pertussis. And then they developed an inactive wholesale vaccination and the first serology. The Nobel Prize in Physiology and Medicine 1919 was awarded to Jules Baudet for his discovery relating to immunity. In the 1920s, USA pediatrics Louis Sauer and Danish physician Thomas K. Madison fight for developing of the pertussis, and Dr. Sauer first developed a weak vaccine in 1931. Inoculating children against pertussis, and he developed the DPT vaccine later. Almost at the same time, Dr. Madison developed a wholesale vaccine to control outbreak of pertussis in North Sea. And American pediatric Leila Denmark, American scientist Grace Adeline, Lonnie Gordon, and Pierre Kendrick, Japan scientist Yuji Sato, they all should be remembered for their outstanding work in developing the various pertussis vaccines. In nowadays, we all know that Bordetella pertussis is one of the members of Bordetella species families, and human are the only host species of Bordetella pertussis. The bacteria is a small gram-negative rod and lactobacilli, strictly aerobic, catalysis and oxidized positive, encapsulated and does not produce spores. Outbreak of pertussis were observed among chimpanzees in a zoo and among wild gorilla. In both cases, it is considered likely that the infection was acquired as a result of the close contact with human beings. Several of those have a long-standing custom of vaccination their primates against pertussis. The bacteria is consist of strong capsule, outer member, periplasm, inner members, and nucleic acid. It can secrete adhesin, toxins, and accessory proteins. Metabolism of the Bordetella Pertussis is carried out by by our uptake system and regulation systems. The pertussis bacteria transmission and colonization of the respiratory tract and its adhesion on the ciliated epicytic cells via the FHA, FM2, FM3, and PRN. Then the bacteria duplication and the spread of the increase in the host mucus. Then the bacteria damage to the ciliated epithelial cells via the TCT and LPS, etc. Secretion of other toxins such as ACT, FHA, and PT also involving the infection processes. And the immunity reaction, hyperlymphocytosis, and other disease presentations is involved in the pertussis infection. Once you become infected with whooping cough, it takes about 7 to 10 days for signs and symptoms to appear, though it can sometimes take longer. They are usually mild and at first, and remember those of a common cold: runny nose, nasal congestion, red, white eyes, and low-grade fever and coughing. After a week or two, in paroxysmal stage, the signs and the symptoms worsen. Thick mucus accumulate inside the airways, causing uncontrollable coughing. Severe and prolonged coughing attacks may, because of the provoking vomiting, struggling to breathe, and resulting red or blue face, and cause extreme fatigue and are exhausting. And the cough ends with a high-pitched whoop sound during the next breath of air. However, many people don't develop the character whoop. Sometimes a persistent hacking cough is the only sign that the adolescent or adult has a whooping cough. Infants may not cough at all. Instead, they may struggle to breathe, or they may even temporarily stop breathing. In infants, especially younger than 6 months old, complications are more severe and may include pneumonia or bronchitis, slow or stop breathing, dehydration or weight loss due to the vomiting, and seizures or brain damage, and the encephalitis because of the swelling of the brain. Because infants and toddlers are at great risk from the whooping cough, they are more likely need treatment in a hospital, and the complications can be life-threatening. For teens and adults, the complication often recover with no problem. However, if the complication occurs, they tend to be side effect of the generous coughing, such as bruised or cracked ribs, abdomen heaviness, and blocked blood vessels in the skins or in the white eye. Laboratory autopsies include blood cell counts, bacterial culture, nucleic acid testing, and serology examination. White blood cells increase during the end of the Carter period and the paroxysmal cough period, mostly 20 to 50, and a few can reach more than 70. Lymphocytes are the mainly present and more common in the infant and young children. Nasopharyngeal secretion can be cultured to produce the Bordetella Pertussis. The positive rate in the early stage and of the kata or the spasmodic cough is high and lower after 3 weeks later. The nucleic acid test for the Bordetella Pertussis in nasopharyngeal swabs or nasopharyngeal lavage samples is positive with a high positivity rate within 3 weeks of the onset. Except 1 year after the last vaccination of the Bordetella Pertussis integrants vaccines, a high PT-IgG can diagnose acute infection, which has great value of cause of the coughing more than 2 to 3 weeks. Recovery period from serum PT-IgG increased by 4 times or more compared to the acute period, which is suitable for the respective diagnosis. This figure shows the relative diagnosis sensitivity of culture, PCR, serology, and clinical diagnosis during the different stages of Bordetella Pertussis infection. The represented sensitivity was idealized for the direct clarity, as the PCR may detect DNA of dead fragments of the bacteria. Positive PCR result may be obtained for 1 or 2 weeks longer than positive culture results. And the culture may be a gold standard, but pertussis is a fastidious bacillus. The PT-IgG is widely used but not applicable for the children with recent immunization. And the PCR is only in the select hospital or CDC. We all know cough, fever, shortness of breath, and vomiting and fatigue symptoms are common in the variety of the repeated infectious diseases and some chronic airway diseases, even more in many kinds of somatic diseases. Therefore, whooping cough needs to be differential from the following diseases. For example, the respiratory, nervous, digestive, and urinary system infections caused by the bacteria, virus, and atypical pathogens. Always inflammation diseases, foreign bodies in the airway, intestinal obstruction or the interception, dehydration, etc. Pertussis is a vaccine preventable disease. The best way of the prevention is with the pertussis vaccine, which often is given in the combination with the vaccine against two other serious diseases, the diphtheria and the tetanus. Doctors recommend beginning of vaccination during the infancy. The vaccine consists of a series of 5 injections, typically given at the 2 months, 4 months, and 6 months, 15 to 18 months, and 4 to 6 years old. Adolescents become immunity from the pertussis vaccine tends to be to when by the age 11. So doctors recommended a booster shot at the adolescent age. For adults, some variety of the every 10-year tetanus and diphtheria vaccine also include protection against pertussis in order to reduce the risk of the transmitting of whooping cough to infant. For pregnant women, health expert now recommended that pregnant women receive the pertussis vaccine between 27 and 38 weeks of gestation. This may also give some protection to the infant during the first few months of life. There are 2 types of vaccine available: DTaP for children younger than 7 years old, and TDAP for older children and adults, and including pregnant women. TDAP is recommended for the pregnant woman in each pregnancy to provide babies with early protection against pertussis. This is crucial because the first few months of life pose to the highest risk for the serious illness, and babies don't receive their first pertussis vaccine until they are 2 months old. It is important for anyone in close contact with newborns and young infants, such as parents, grandparents, or child care provider, to ensure they are up to date on their pertussis vaccination. And a good habit of hand hygiene is also can help to reduce the spread of the infections. If you have been exposed to the whooping cough, your doctor may recommend the antibiotics to protect against the infection, especially if you are a healthcare provider or pregnant, or you are younger than the 1 year old, or you have a health condition that could put you at risk of severe illness or complications, or live with someone who has whooping cough, or live with someone who is at high risk of developing severe illness or complication from a whooping cough infection. The most common used antibiotics for treating or preventing pertussis are microlized antibiotics, such as the azithromycin, clarithromycin, and erythromycin, etc. Sulfonamide and fluoxetine can also be used. The dynamically updated guidelines provide evidence-based recommendations. Attention should be paid to the contraindications in patients with different age and past illness history. So in the part 2, we'll discuss the epidemic and reemergence of pertussis. This world map distribution figure shows the potential trend of pertussis global, standardized by the age from 1980 to 2021. We can see the red and the orange areas in Australia, North America, Mid-Asia, and Africa. The dates sourced from GBD database published in this year. It means that the incidence rate of pertussis in this area in 2021 has increased significantly compared with that in 1980. These figures show the cause of death global in recent 40 years, update to 2021. We can find the increasing trend of pertussis death rate in 15 to 40 years old adult male. And a similar increased trend of pertussis death rate was found in the adult female in this age range. This is the data from CDC in United States also show that pertussis has experienced a peak in the case growth in the past 30 years. This picture shows a magnificent display of the incidence peak data previous. So we name it the reemergence of pertussis. Pertussis occur all years round with March to September being the peak period and July to August reach its peak, showing a high incidence in summer and autumn and a low incidence in winter and spring. Source of the infection, the patients and the carriers are the main cause of the infections. And the pertussis mainly transmitted through respiratory droplets, but can also be transmitted by close contact. And the susceptible population is generally, all the population is generally suspected. Emergence of the pertussis was due to the weakened immune system and variation of the Bordetella Pertussis after the vaccination. In many countries with high vaccine coverage have experienced a reemergence of pertussis with the peak age of onset shift from infant and young children to the adolescent and adults. And adults have become the main source of infection for infant patients. This is data from the WHO showed the pertussis cases per 1 million total population by countries. We can observe that the migration of the incidence rate between the global regions, especially the significant changes in the North American, European, and in China. The epidemic changing curves of the pertussis global by 6 WHO regions. The figure show a rapid increase of deep blue and orange color, which is in Europe region and West Pacific region, update to the 2023. According to the statistical data of the WHO from 2001 to 2023, the countries with high incidence rate of whooping cough reported globally include the United States, India, Japan, and China. The incidence rate of the pertussis reported by China is relatively low compared with the three countries, but it's gradually rise after the 2017. This slide shows the incidence rate of the pertussis in Chinese mainland from 1950 to 2020. The incidence rate changes periodically with the vaccination of the different kinds of the vaccines in different periods of time. This is the latest epidemic data of pertussis reported by the China CDC. The picture showed the reported cause of the pertussis increasingly years by years from 2010 to 2023. The reported cases of pertussis decreased from 2020 to 2021 and rose again in 2022, reaching the highest level since the 1989. After a shortly rest in 2023, an explosive increase of pertussis cases was reported since January this year, and which reached up to 115,000 at the end of April, the last one about 2 months ago. From January to April in 2024, the 150,000 cases were reported in China, and nearly 45 times higher than the same period in the in 2023, and which caused to deaths of 20%. So 2024 is expected to be the year with the highest reported incidence in the recently 37 years. For a long time, the public, including most healthcare providers, have held the belief that pertussis is only a childhood disease, and that lifelong immunity can be obtained through infection recovery and vaccination. But it's wrong. The survey result of the emergency of the pertussis in the past 30 years show that, unlike in the pre-vaccine era, there has been an increase in infant cases among pertussis patients, and the proportion of the reported cases of pertussis among adolescents over 10-year-old and adults has increased more significantly. However, there has been no corresponding change in the domestic pertussis reporting data, which is closely related to the infected public and clinical awareness. So teenagers and adults are not only infected with pertussis, but also an important group of infection in the vaccine area. Last demonstration research showed that the estimated incidence rate of the pertussis in our age groups more than 3 years old may be more than 1,100 times by the reported incidence rate. Among them, the actual incidence rate of people more than 15 years old is estimated to be 25,000 times higher than the reported incidence rate. This indicates that pertussis cannot be recognized among young people and adults in China, and this situation has existed for a long time, not just in the recent several years. The incidence rate of whooping cough in China is seriously underestimated for the following reasons. First is the active monitoring of pertussis cannot be fully established in China, and typical cases of pertussis were misdiagnosis in clinical practice. Many hospitals have not conducted the laboratory diagnosis method of pertussis, and the Bordetella Pertussis is highly resistant to first-line antibiotics such as macrolides. So the reasons for the emergence of pertussis are multifaceted, and the importance of each cause varies among different countries, include the improvement of the diagnostic technology, improvement of monitoring system, and insufficient vaccination dose. APV-induced short protection period and vaccine antigen drift of circulation strains, and it can cause transmission of other Bordetella species similar to the pertussis syndrome. The left columns show the vaccination rate in the various global regions. Although China has the highest vaccination rate, the right slide curve also shows a trend of reemergence of the pertussis. Similar to China, high vaccination coverage still cannot prevent the reemergence of pertussis in Europe and in America. Another aspect, the difference between official statistical data and actual vaccination coverage perhaps also be one of the reasons for the increase of pertussis cases. The bars show the number of the pertussis cases reported globally in year from 1980 to 2018. And DTP3 coverage as a percentage is shown for the both official coverage and the WHO UNIFIS estimated, the blue line and the red line. The evolution of pertussis in China may be driven by the selection pressure of the vaccines and antibiotics, which lead to a decrease in vaccine efficacy and the development of antibiotic resistance. So it's necessary to study the bacterial variation of the Bordetella pertussis in China. Tianjin, the city I worked at, had already fully applied the DTaP vaccine before 2010. However, it's one of the first cities in China to report the emergence of pertussis after 2010. And its high population density contributed to the spread of pertussis. Some of other provinces show a similar increases in the pertussis cases. During sensitivity tests has conducted on the Bordetella Pertussis isolated from Tianjin area, and it was found that multiple strains were resistant to antibiotics to varying degrees. Among them, the erythromycin resistance rate was more than 94%. We in the part 3, I will briefly introduce a prospective regional cohort study of pertussis in adult cough patients by my team. Background and the current status of the study is mentioned ahead, and I'm not going to repeat it. This is a brief protocol of the cohort study. The objective is to investigate the incidence rate of the pertussis and their clinical characteristics in adult patients with cough symptoms in Tianjin. And the inclusion criteria is adults or the adult more than 10 years old, no upper limit. Clinic patients with a chief complaint of coughing. Exclusive criteria include the cause of cough considered to be tuberculosis and thoracic deformations, tumors of the lung, trachea, and bronchi, interstitial lung diseases, or conjunctive airway structure abnormals, foreign bodies in airway. This is cause of the coughing. The results in order to enrollment of the participants were carried out in the three hospitals in Tianjin last year, and a cohort of the cough patient was constructed. Let's briefly see the results. There is no significant difference of the infection rate between male and female adult. Vaccination provides a well protection effect. Most of those pertussis infected patients was without the history of the vaccination. And in our study, smokers did not show a higher pertussis incidence rate. In about 72% adult pertussis patients, their course of cough was less than 3 weeks, and their most common symptoms was about half of the paroxysmal cough, and about 14% fever, 13% vomiting after cough, and 11% suffered pneumonia. 7% had apnea after cough, and only 6% have whooping sound. 60% of the adult cough patients result in Bordetella Pertussis positive PCR testing. About half of the patients in our cohort have a past history of at least one kind of chronic diseases, such as hypertension, diabetes, coronary heart disease, COPD, asthma, other pulmonary diseases, chronic rhinitis, pharyngitis, autoimmune diseases, and some other chronic disease. In this study, we found that there were family aggregation characteristics. A total of 58 families were investigated, and out of which 25 families had family aggregation. Scatter plots of blood cells counts and age-related source. There's no static difference in the correlation between total white blood cells count and age. There are significant static difference in the correlation between neutrophils, lymphocytes, monocytes, and platelets with age. Further analysis revealed that the symptoms of the adult infection with pertussis are atypical and or mild, and the true burden of pertussis in the adult population is greatly underestimated. The incidence rate of the adult whooping cough varies due to the different patient select criteria and experiment methods. Adult pertussis exhibit family aggregation. The transmission mode of the pertussis has shifted from child to adult mode, shift to adolescent adult to child mode. The research showed about 90% families contact and 50 to 80% schools contact are infected later. However, there is some limitation in this study. Laboratory tests other than the PCR were not used for the screen. The sensitivity of PCR monitoring decreased with the duration of the symptoms, and some false negative results may occur. We have no analysis was performed for the virus and the bacterial infections. It is hard to determine whether the patient has other co-infections. So that's all, and some message you can take home. The pertussis is caused by the bacteria Bordetella Pertussis, and it's highly contagious and spread from person to person, mainly through droplets. And due to insufficient reporting and testing, the incidence rate of the adult pertussis is seriously underestimated by 10 times or even 100 or 1,000 times. Vaccination cannot provide lifelong immunity, and it is necessary to re-vaccination with TDAP for pregnant women, with adults, and family members who will close contact with the infant. Symptoms of pertussis in adults are atypical and can coexist with the chronic respiratory diseases, making it difficult to detect and with great harmful. In order to diagnose acute pertussis, PCR test using nasopharyngeal swab should be performed rather than the culture and other testing. The drug resistant rate of the pertussis to azithromycin is increasing. Azithromycin is the preferred drug recommended by most of the guidelines, while sulfonamide and moxifloxacin can be used as alternatives. That's all. Thanks for your attention.